10 months since the country rolled out universal healthcare in 4 pilot counties, namely Isiolo, Nyeri, Machakos and Kisumu, key actors in the health sector claim tangible gains have been witnessed in the health sector in the said counties.
For the first time, health workers can prescribe essential medicines in the spaces where we were piloting that were previously out of stock. And it now takes a shorter time to have the commodities delivered to the facilities. The lessons that have been gathered through this pilot phase have formed the first sketch of the transformative blueprint that we'll be pursuing as we go to scale up of UHC.
Over the last 6 years, we've witnessed one success after another in all the 47 county governments on increased number of reduction in the distances to the nearest health facility, in the employment and recruitment of health staff.
Health Cabinet Secretary Sicily Kariuki, speaking during the 2019 Health Forum that sought to highlight milestones of UHC in the 4 pilot counties, said there's need for the country to set aside more funds for the healthcare sector and embrace systematic reforms.
Both levels of government have defined roles that are critical and symbiotic in the delivery of healthcare services. And that is why we find it in our place to be useful and available to consult as and when need arises, and even when we are planning for interventions that will normally appear to be national level interventions, we always find it necessary to consult and involve ourselves jointly.
Allocation to healthcare being less than 2% of the country's GDP, the stakeholders are proposing at least 5% allocation to change the narrative of poor and affordable healthcare. The stakeholders further want the country to build a consensus and chart a way forward in ensuring counties are adequately funded to handle healthcare.
The landscape for health financing is shifting tremendously following the rebasing of our economy as we get into a middle-income country. I'm sure that all of us present here today are alive to this new reality. We must therefore begin to look for answers to questions about the financing of essential health services such as HIV/AIDS, tuberculosis, malaria, vaccines, blood banks, and family planning.
We demand that all regulatory agencies report to work and redirect their focus to the patient. And we urge the ministry to expeditiously fully operationalize the Health Act 2017 that was negotiated by both houses to cure several of our problems. We will not shy to demand the counties to use funds meant for health for these specific functions through ring-fencing of these finances.
The Senate will resist any effort to undermine devolution in general and devolution in health in particular.
For Channel 1 News, I'm Gladys Mungai.